This is Garth Reynolds, your Executive Director of the Illinois Pharmacists Association, and this webinar is to go over the new pharmacy workplace rules enacted by Public Act 101-621. Our objectives are going to be very brief. We're going to be looking at the timeline, reviewing the timeline and recommendations of the Collaborative Pharmaceutical Task Force, discuss the recommendations of the Enhancing Well-Being and Resilience Among the Pharmacist Workforce Consensus Report, describe the new regulations in effect on January 1 of 2020 in relation to the pharmacy workplace, and explain how to file a complaint with the Illinois Department of Financial and Professional Regulation. So let's briefly talk about the Collaborative Pharmaceutical Task Force. So why do we have the task force? As you may recall, we had the task force as a result of Chicago Tribune articles in the December of 2016, and as a result of House Bill 2392 and House Bill 3462. And those, excuse me, those two bills helped establish a task force to take a look at prescription and practice limitations and other workplace issues that may be endangering patient safety. And members of the task force were both voting and non-voting members, IPHA, ICHP, the Illinois Retail Merchants Association, the Illinois Association of Long-Term Care Pharmacy Providers, the Illinois Health and Hospital Association, the State Medical Society, and the Teamsters all had one voting member each. The University of Illinois, Chicago College of Pharmacy, the UI Health System, and the department each had a non-voting member. And our chair was Phil Burgess, former chair of the Illinois Board of Pharmacy and a current NABP Executive Committee member. We met monthly from January 2018 to August of 2019, and we addressed 16 issues that were laid out in House Bill 3462, mostly based from House Bill 2392 during the last General Assembly. In the discussion of these issues were also there was discussion of many other issues relevant to the advancement of the pharmacy practice and of patient care. So the task force had a very wide net to be able to look at all aspects of the pharmacy workplace. So issues discussed, considered by the task force for any recommendations were whistleblower protections, pharmacy technician on duty, any prescription limit or quotas, pharmacy technician hours, prohibition of distractions, mandatory breaks and lunches, no work during break, triple pay for no break, break rooms, break records, an 8-hour workday, maintaining error records, report of prescription discontinuation, patient verification, and detailed auto prescription refill notices were additional items that were added in the House Bill 3462 from the initial legislation that came through. And then based on discussions, we expanded into pharmacy technician continuing education and employee terminations, and also looked at reviewing systems for compensation of pharmacist services in Illinois. So the recommendations of the task force, excuse me, the task force did recommend that we would restate whistleblower provisions that were already covered under the Whistleblower Act. There was nothing new that added any additional provisions in the recommendation to the Pharmacy Practice Act. It was just stating that there is a Whistleblower Act and you are covered. Pharmacy technicians on duty. The task force did recommend against the adoption of any language within the Pharmacy Practice Act or rules concerning number of technicians on duty at any given time. Concerning a prescription limit, the task force did not recommend a specific limit, but did adopt grounds for discipline language that could be utilized in the administrative rules for failure to provide a working environment for all pharmacy personnel that protects the health, safety, and welfare of a patient. Prohibition of distractions. Again, to help address this was adopted under the recommendation language from the task force in the grounds for discipline section, stating that sufficient personnel needed to be to prevent fatigue, distraction, or other conditions that interfere with a pharmacist's ability to practice with competency and safety or creates an environment that jeopardizes patient safety or patient care. Concerning mandatory breaks or lunches, the task force did recommend a modification of pharmacy work conditions and stated that pharmacists working longer than 6 continuous hours should be provided time for a 30-minute uninterrupted meal break and at least one 15-minute break. If a pharmacist would qualify for an additional 15-minute break if they were working 12 continuous hours. And no pharmacist should be required to work longer than 5 continuous hours per day without the opportunity to take an uninterrupted meal break. For no work during a break, the task force again referred back to the grounds of discipline language that the task force adopted that said, again, failure to provide a work environment for all pharmacy personnel that protects the health, safety, and welfare of a patient. Because we know there are always going to be emergency situations that occur that may interrupt a work break, but we want to make sure that those interactions are far and few between. Triple pay for no break. The task force recommended against any adoption of any language concerning this type of practice in Illinois. A break room. The task force did recommend against the adoption of language within the Pharmacy Practice Act, and we'll discuss that here a little bit further. Break records. The task force did recommend the adoption of language stating that that an employer shall keep and maintain a complete and accurate records for breaks of a pharmacist. An 8-hour workday. The task force did not adopt the recommendation for an 8-hour workday, and there were many discussions of why the pros and cons of that. A lot of it does come down to economics and comes down to the current pharmacy reimbursement methodology system. But the task force did adopt language and approved language stating that a pharmacist shall work no longer, or a student pharmacist or a technician shall not work longer than 12 continuous hours per day. Maintaining records, error records. The task force did recommend approving that all pharmacies should be part of a continuous quality improvement program. Reporting of prescription discontinuation. The recommendation of the task force would be that effective January 1 of 2021, that all pharmacies should start using the script standard for receiving electronic prescriptions that would enable and activate and maintain the ability to receive prescriptions for a DC or discontinuation order, and that the pharmacy shall act upon those requests within 2 business days. Patient verification and detailed automated prescription refill notices. Basically, the task force adopted language and a position that prescriptions should have the patient's permission before they're refilled and put into an auto refill program each and every time. Additional considerations by the task force centered around pharmacy technician continuing education and employee terminations. There was recommended amendments to the act or acts of, mainly looking at language of what a technician could and could not do. And so this would require that technicians be specifically trained for tasks for which they are assigned and to accomplish, while retaining the exception that certain tasks cannot be delegated to technicians. Basically, they cannot counsel, they cannot do clinical drug resolution, and they cannot do drug utilization review. That for any tasks that they may be required, that they need to have specific training, and that starting in 2022, that the certified technicians must complete an ACPE ASHP accredited training program or equivalent experience to be able to set for the PTCB exam. And so this type of a shift would permit pharmacy technicians to administer vaccines to individuals as long as they had successfully completed a training course on the administration of vaccines that's approved by the department and are directly supervised by a pharmacist who has also completed the APHA immunization pharmacy-centered immunization delivery certificate training program. And finally, on a review of systems for compensating pharmacists in Illinois, the task force strongly recommended a continued effort in forming an additional task force to look at the remuneration of pharmacists for their professional patient care services separate from the sale of drug products, and that additional task force would be needed to be able to look at this and make further recommendations for amendments to the Pharmacy Practice Act or other additional acts, including the Insurance Code. Pharmacists Well-Being and Resilience. IPHA was fortunate enough in July to be part of the Enhancing Well-Being and Resilience Among the Pharmacist Workforce Consensus Conference. Amongst us and 84 other individuals representing the complete spectrum of pharmacy, including the colleges, regulators, accreditors, and other professional organizations, we came up with 50 recommendations of these categories of pharmacist work conditions and patient safety, payment models, relations between pharmacists and employers, pharmacists and student pharmacist well-being, well-being education and training, communications, data, information, and research on pharmacist well-being. These are the recommendations of this report, and I do highly encourage you to take a look at this report. And a link to these slides and to this report will be provided below. But the pages of the report and the recommendations have been provided here as well, if you wish to pause the video. The IPHA House of Delegates, in addition to what was provided in the consensus report, decided to pass policy this past September concerning pharmacists and pharmacy personnel well-being and resiliency. It states that IPHA strongly believes in the well-being of pharmacists, student pharmacists, pharmacy technicians, and all other members of the pharmacy care team is essential for the safe and effective patient care and for overall high-functioning work performance. And all pharmacist personnel and student pharmacists shall be safe in their work and learning environments. And we have 6 additional points in addition to supporting that statement, including the very first one, that IPHA supports the recommendation of all 50 recommendations of the Enhancing Well-Being and Resilience Amongst the Pharmacy Workforce Consensus Conference report. So let's dive into Public Act 101-0621. It originated as Senate Bill 2104 and was sponsored by Senator Emil Jones and Representative Mike Zaleski. This bill was passed during the veto session this past November and was signed into law by Governor Pritzker on December 20th of 2019. It first and most importantly renews and extends the Pharmacy Practice Act sunset until January 1st of 2023. That went effective on December 20th of 2019. There were many different modifications to the Pharmacy Practice Act, and we'll be going through them section by section. Excuse me. The very first was to Section 4.5 of the Pharmacy Practice Act. And it states that there'll be a continuation of the Collaborative Pharmaceutical Task Force until October 1st of 2020, with a report to the General Assembly no later than November 1st of 2020. There will be 2 additional task force members, one from the Illinois Retail Merchants Association and one from the Teamsters. An additional 2 members from the Senate and 2 members from the House, representing the majority and minority parties, will also be additional members to the task force. Now on to Section 9 concerning pharmacy technicians. There's an additional language which is highlighted here, and you'll see some language that was stricken that clarifies what technicians can do in the state of Illinois. A registered pharmacy technician may be delegated to perform any task within the practice of pharmacy if specifically trained for that task, except for patient counseling, drug regimen review, and clinical conflict resolution. So let me be clear. As long as the task is not patient counseling, drug regimen review, or clinical conflict resolution, a technician can be trained and shall perform that task as designated by the pharmacist on duty. That means taking of prescriptions. That means the transfer of prescriptions. That also means the administration of immunizations. So this takes us to a next step in being one of the more progressive states again when it comes to allowing technicians to take some of the burden off of pharmacists on the administrative tasks and being able to assist in the delivery of patient care in Illinois. Sections 9.5 and 17.1 state that a certified pharmacy technician must complete an ASCPE education or board equivalent training before they take the PTCB exam. The training must be completed within 2 years after their initial licensure and within 6 months prior to any new duties or responsibilities. So again, that training, now this can be after they've taken the PTCB exam, completed all this initial training. If they get a new duty, they need to be trained in that new responsibility 6 months prior to taking it on. That is effective January 1 of 2022. So we don't have to worry about that just yet. So now let's dive into one of the largest additions to the Practice Act with this bill. And that's section 15.1. This states that pharmacists, student pharmacists, and pharmacy technicians are to be scheduled and work no more than a 12-hour shift, period. After working 6 hours, a pharmacist shall be provided a 30-minute lunch and a 15-minute break. If a pharmacist is scheduled for 12 hours, an additional 15-minute break is provided. Now, you'll notice that the language states pharmacist, doesn't address student pharmacists or pharmacy technicians. According to the Illinois Labor Code and Labor Act, they should already be receiving these. If the pharmacy or business has a private break room available, the pharmacist is entitled to breaks, must be given access to the private break room and allowed to spend their break in that room. Again, this is effective January 1, 2020. Let's take in addition, if a pharmacy may, but is not required to close when a pharmacist is taking a break. But if the pharmacy does not close, the pharmacist shall remain within the licensed pharmacy or within the establishment in the licensed pharmacy and be able to attend emergencies if required. Pharmacy technicians, student pharmacists, and other supportive staff authorized by the pharmacist on duty may continue to perform duties as allowed under the Act. But no duties reserved to pharmacists and student pharmacists under the Act or that require the professional judgment of a pharmacist may be performed by pharmacy technicians or other supportive staff. And again, that's effective January 1, 2020. If the pharmacy decides to remain open, only prescriptions that have received final verification by a pharmacist, and I've included the actual language in here instead of shortening it down for you in this section, just so there's no misunderstandings. Only prescriptions that have final verification by a pharmacist may be dispensed while the pharmacist is on break, except those prescriptions that require counseling by a pharmacist, including all prescriptions and those refilled prescriptions for which a pharmacist has determined that counseling is necessary, may be dispensed only if the following conditions are met. 1, the patient or individual who's picking up the prescription is told that the pharmacist is on break and is offered the chance to wait until the pharmacist returns to receive counseling. If the patient or other individual picking up the prescription declines to wait, a telephone number must be obtained from the patient so they can be reached out to. 3, after returning from the break, the pharmacist must make a reasonable effort to contact the patient or the individual picking up the prescription and provide counseling as according to the Act. 4, the pharmacist shall document the counseling or document why counseling was not provided after a minimum of 2 attempts to contact the patient or individual. Documentation shall be retained and shall be retained for at least 2 years. This is effective January 1, 2020. Continuing on with section 15.1. In a pharmacy staffed by 2 or more pharmacists, the pharmacist shall stagger their breaks so at least one pharmacist remains on duty at all times during the time that the pharmacy remains open for transaction of business and the delivery of patient care. A pharmacy shall keep and maintain a complete and accurate record showing all pharmacists' daily break periods. And if the subsections shall not apply when an emergency as deemed by the professional judgment of a pharmacist necessitates that a pharmacist, a student pharmacist, or a pharmacy technician work longer than 12 continuous hours, work without taking required meal breaks, or have a break interrupted in order to minimize immediate health risks for a patient. Again, this is effective January 1, 2020. Now let's take a look at some of the additional sections. Section 22C, which is new. A patient must enroll each medication into an auto refill program. This is effective January 1, 2020. Pharmacists must utilize the script protocol for electronic discontinuation orders and act upon them within 2 business days. We get a year off from this one. This is not effective until January 1 of 2021. Now let's look at violations, finally, in the last section of the Act, Section 30. The use of advertisements or making solicitations that may jeopardize the health, safety, or welfare of patients, including but not limited to the use of advertisements or solicitations that are false, fraudulent, deceptive, or misleading, or B, include any claim regarding a professional service or product or the cost or price thereof that cannot be substantiated by the licensee. This is effective January 1 of 2020. And in this section 30 and the remaining slides, I am including the exact language so that there is no miscommunication or understanding. Requiring this could be considered a violation if requiring a pharmacist to participate in the use or distribution of advertisements or in making solicitations that may jeopardize the health, safety, or welfare of a patient. It may be considered a violation for failing to provide a work environment for all pharmacy personnel that protects the health, safety, and welfare of a patient, which includes but not limited to failing to, and you may remember this language because this is from the task force recommendations. If they are failing to employ sufficient personnel to prevent fatigue, distraction, or other conditions that interfere with the pharmacist's abilities to practice with competency and safety, or creates an environment that jeopardizes patient care. Provide appropriate opportunities for uninterrupted rest periods and meal breaks. Provide adequate time for a pharmacist to complete professional duties and responsibilities, including but not limited to drug utilization review, immunization, counseling, verification of the accuracy of a prescription, and all other duties and responsibilities of a pharmacist as listed in the rules of the department. This is effective January 1, 2020. And finally, introducing or enforcing external factors, such as productivity or production quotas, or other programs against pharmacists, student pharmacists, or pharmacy technicians to the extent that they interfere with the abilities of those individuals to provide an appropriate professional service to the public. Providing an incentive for or inducing the transfer of a prescription for a patient absent a professional rationale. And finally, as a reminder, any person who reports a violation to this section of the department is protected under subsection B of section 15 of the Whistleblower Act. This is effective January 1 of 2020. And with this last section, these are, the language in here can be a little general, and that was to make sure that we are trying to address the broad range of how pharmacy is practiced in Illinois. We cannot be able to describe every situation, every practice setting in this scenario. And that's why we've left it up to the inspectors and the Board of Pharmacy to be able to determine if a violation has occurred under the Act. Now, IPHA has received comments from some members that employers have stated that there is a 90-day grace period or a certain amount of time before you have to be in compliance with the Public Act 101-621. That is incorrect. We have confirmed with the department today on December 31st of 2019 that the entirety of the sections that are listed as effective January 1, 2020 are in fact in effect on January 1, 2020. No exceptions. So let's talk about how to file a complaint if you feel that your employer or pharmacy is in violation of the new Public Act. You may file an official complaint with the Illinois Department of Financial and Professional Regulation, or IDFPR, and this is the web address to be able to get to the complaint site and section. A pharmacy compliance inspector will follow up on the complaint and take appropriate action if required. If you go to the department's website and you go to the pharmacy section, you will see here in the middle, there is the file a complaint option. You click on that, and that takes you to the various 4 different sections of the Department of Financial and Professional Regulation. You click on Professional Regulation, and you click on File a Complaint. You will have 2 options here. You can file an online complaint form, or you can do the old-fashioned way and print one out, fill it out, and mail it to the address below. And there is an additional phone number for be able to assist with any questions that you may have. And here is an example of the online complaint form. Again, we wanted to provide this quick webinar as this rule goes into effect on January 1 of 2020 to help clarify any miscommunications and misunderstandings about this very important and groundbreaking change in how we're practicing pharmacy in Illinois to ensure well-being of pharmacists and their resiliency, and to, most importantly, enhance the delivery of patient care and safe patient care in Illinois. But please feel free to contact me. My email is here, greynolds@ipha.org, or you can contact the office. Please follow us for any updates on Facebook and Twitter, or on Instagram or YouTube. And we do highly encourage that if you aren't already a listener, please do subscribe and listen to the Illinois Farm Talk podcast, which will go into even more detail as these new regulations are rolled out. Thank you very much for your time. Happy 2020, and we'll see you in the next year.